Hello guys, this is CT4071. We're on lesson 3 now. We're moving out of the thorax and into the abdomen and pelvis area. And we'll be studying that for quite a while until we get to close to the end of the semester. Then we'll talk about extremities. So study of the imaging of the abdomen and pelvis requires a slightly different approach because there are many organs and body systems contained in the abdomen and pelvis. Organ-specific protocols exist, and we're going to explore those as we go along. Both texts will start with a general overview of the CT abdomen pelvis scan itself, and then they talk about each organ and the protocols associated with it. So we'll begin our study of the abdomen and pelvis with a review of peritoneal and retroperitoneal abdominal sections and structures. DeMaio covers this as well in the beginning sections of the abdomen and pelvis. A thorough understanding of the retroperitoneal versus peritoneal locations of organs is important for CT techs to differentiate where fluid will gravitate toward, and this understanding will enable the CT tech to communicate with the radiologist more effectively as well when they're discussing the organs and scan protocols. Excuse me. Retroperitoneum is defined as being the peritoneum in the posterior abdominal wall. Is defined as being between the peritoneum and the posterior abdominal wall. The peritoneum is a large complex of serous membrane which forms as a closed sac within the abdominal cavity. The development of the peritoneal sac during gestation and subsequent forming of the peritoneal cavity is as follows. During development, some organs of the abdominal cavity protrude from the abdominal wall into the peritoneal cavity and carry a covering of peritoneum with them. And the layer around the organs is called the visceral peritoneum, and it is continuous with the parietal peritoneum, which is the covering of the abdominal wall. And as the organs continue to develop, the peritoneal cavity is obliterated, leaving only the potential space between the visceral and the parietal layers of the peritoneum. In males, the peritoneum cavity is closed, and in females it communicates with the exterior through the uterine tubes, uterus, and the vagina. Organs and structures that are included in the retroperitoneum can be remembered using this acronym SAD-PUCKER. The S stands for the suprarenal glands, or the adrenal glands. A is aorta and IVC. D is duodenum, which is the second and third segments. Some also include the fourth segment, but the second and third segment for sure of the duodenum is retroperitoneum. P is for pancreas. Only the head, neck, and body are retroperitoneal. The tail is actually intraperitoneal. U is uterus. C is the colon. Only the ascending and descending colon, as the transverse and sigmoid retain mesocolon. K is for the kidneys. E is for esophagus. R is for the rectum. Now, these are the structures that are retroperitoneal. So this slide demonstrates the peritoneal and the retroperitoneal organs. This patient is prone, so the spinal cord is and the vertebral body are posterior. The kidneys are to the right and left of the spine, and the green lines are outlining the peritoneal cavity as it lines the organs included in it. You can see how it covers the spleen and then kind of doubles back on itself and goes back around this way and folds over here, and you have a large intestine and kind of winds its way back this way. And so there's several areas in the peritoneal lining that doubles over itself, and so as you can see in this image, that retroperitoneal organs and structures on this slice are the pancreas, small intestine, duodenum, the kidneys, the aorta and the IVC, the ureters, and a portion of the large intestine. To give you a CT image perspective, this slide demonstrates a CT image with the peritoneal and retroperitoneal structures separated by the dotted line. Again, retroperitoneal structures included on this image are the pancreas, the aorta, IVC, and a portion of the left kidney. And here they are: the pancreas, the aorta, IVC, and a portion of the left kidney. That's all you see on this slice. All these organs are peritoneal. In addition to the peritoneum, the retroperitoneal spaces, retroperitoneal organs, there are retroperitoneal and peritoneal spaces that are important for diagnosis and for helping us to understand how fluid moves and settles or layers out in the supine, prone, or lateral recumbent positions of the patient. There are two major compartments, the supracolic and the infracolic compartments. Most important subdivisions of these two compartments are the left and right subphrenic spaces. That's where you're going to see a lot of ascites. And then the right subhepatic. And then the right and left pericolic gutters are down low in the abdomen and the pelvis area. The pericolic gutters are mentioned many times in radiology reports in CT abdomen pelvis to describe location of free fluid within the abdomen pelvis. So you'll see that term used a lot. Peritoneal cavity contains these. I don't really have an acronym for these, so you just have to learn them. The stomach, the small bowel, the transverse colon, liver and gallbladder, spleen, and ovaries. And like we said before, the male peritoneal cavity is closed in the males. It's open through the fallopian tubes, uterus, and the vagina in the females. Peritoneum contains a double layers and folds that surround and support the abdominal organs. These are the mesentery, which is a thick portion of the peritoneum that attaches portions of the intestine to the abdominal wall. The vessels of the mesentery are beautifully displayed during the CT enterocolitis scan we'll talk about a little bit later. But it highlights the small bowel with low density barium and other oral contrast, and it utilizes an early scan time to catch those mesenteric arteries that would be flowing through here, through the mesentery. So the omentum is a mesentery that's divided into lesser and greater components. Each is responsible for attaching portions of the stomach and the intestines. The anatomical image on this slide demonstrates the mesentery connected to the large intestine and the arteries flowing through it, which supply blood to the colon here. The anatomical images on this slide demonstrate the greater and the lesser omentum. On the left image, the greater omentum covers the small intestine and the large intestine and connects it to the abdominal wall. And here we go with the lesser, and it's connected to the stomach here, greater curvature of the stomach. And then on the left on the right, lost my place, sorry. On the right, we see the greater omentum attaching to the greater curvature of the stomach and the lesser omentum connected to the lesser curvature posteriorly here. Lesser omentum, greater omentum. This is also greater omentum, but it's attaching to the small intestine. Transverse colon is underneath here. All of this kind of drapes over and keeps the organs where they need to be so they're not bouncing around all inside us. Alright, so now that we've got that out of the way, let's talk about the scan parameters for CT abdomen. And for the scout image, the patient's supine, and an AP and sometimes lateral scout is taken. Anatomy included for the scan parameters. You're going to start superiorly just above the diaphragm extend inferiorly through the aortic bifurcation, which is approximately at the iliac crest. And if the pelvis is to be included, then the scan lines are going to continue inferiorly through the pubic symphysis. Patient's arms should be raised above their head, resting on a pillow. The breathing instructions include inspiration and a breath hold. Window widths and levels for CT abdomen will vary with sometimes with the organ that you're looking at. Liver is one example I can use that we use some different type windows. They're called liver windows. We'll talk about those a little later. But the window widths normally for soft tissue, the window level's at 40 and the window width is at 350. And then for lung bases, which is where you're going to start above the diaphragm, you need to include some lung windows along with the abdomen pelvis for the radiologist to review. And you're going to have a window level of negative 450 and then a window width of 1400. And then if you do bone windows, they need to be at 300 window level at a 2000 window width. Patient preparation for CT abdomen pelvises. Routinely and ideally, you want the patient NPO and fasting 2 to 6 hours prior to the exam. This doesn't always happen in the ER, but for the most part, if you can get the inpatients fasting and the outpatients fasting, then you're going to have a better scan, because this results in an empty proximal GI tract and facilitates evaluation, and it also limits the potential hazard of aspirating stomach contents in the event of GI upset due to IV contrast administration. So if somebody gets nauseated while you're giving them contrast, if they've been fasting, they have nothing to aspirate if they vomit while they're laying down. Some patients are unconscious, and that can be an issue. So you have to kind of watch that. In most cases, an oral contrast is administered to distend the GI tract and clearly demonstrate the intestinal lumen. The agent used may be a dilute solution of iodinated contrast medium, barium sulfate, or water. For general studies of the abdomen pelvis, 750 to 1,500 milliliters of oral contrast is administered 30 to 120 minutes before the exam. Different dosing protocols include the 450 milliliters 90 to 120 minutes prior to the exam to pacify the distal intestines, 300 to 450 30 minutes prior to the exam to pacify the proximal intestines, and then 150 to 250 milliliters just prior to the exam to pacify the stomach and duodenum. This last part, the 150 to 250, is given. That's given after you've waited either the 2 hours or the 2.5 hours before the scan. You give them 150 to 250 milliliters just prior to scanning it, just to pacify that proximal portion, stomach and duodenum. CT evaluation of the abdomen pelvis requires greater attention to patient preparation than the CT evaluation of any other area of the body. Most CT scans of the abdomen require administration of oral contrast to demonstrate the intestinal lumen, like we talked about, and distend the GI tract. The use of oral contrast material is imperative to differentiate a fluid-filled valve loop from a mass or an abnormal fluid collection. So either a dilute barium suspension or a dilute water-soluble agent may be used with equal effectiveness. Air and water are excellent as low attenuation contrast agents. Air or carbon dioxide is frequently used to insulate the colon for CT colonography, which produces a very high negative contrast. Water or low household unit oral barium sulfate suspension, such as volumen, is sometimes used in place of the positive contrast agents. And these low household unit agents will not obscure mucosal surfaces or superimpose abdominal vessels on the post-processed images. And these volume and like I said, for the that show the mesenteric vessels, it's very important to use that for CT angiography of those vessels, because if you use regular barium, then you'll kind of obscure mucosal, and you might even miss some vessels that are traversing through there. Few institutions routinely administer rectal contrast material, but it can be done. When it's used, the most common indications for colon cancer staging. The bladder is best appreciated on CT when it's filled with urine or contrast agent. So remember that when you have your inpatients or even ER patients with catheters, you need to make sure you clamp that catheter off before you do your bladder delay, or you're not going to have any contrast there by the time you've waited your 2.5 minutes to scan the bladder, and it's not there if you haven't clamped that catheter. The vagina is seen on cross-section as a flattened ellipse of soft tissue between the bladder and the rectum, and an inserted tampon will outline the cavity of the vagina with air density, and it's useful in identification of the vaginal canal. IV contrast agents improve the quality of the studies of the abdomen and pelvis by pacifying the blood vessels, of course. It increases the density, the CT density of the vascular abdominal organs, and improves the image contrast between lesions and normal structures. The appropriate timing, rate, and dose of the IV contrast agents are essential, and for most examinations of the body, image acquisition must be completed before IV contrast medium reaches the equilibrium phase. So modern CT scanners can accomplish this. As a result, the pre-contrast scans are now seldom obtained for routine abdomen studies, just to save radiation dose, and but it may be useful for specific indications such as fatty infiltration of the liver or other organs, or other alteration of parenchymal attenuation. Another aspect of abdominal scanning is multiphasic imaging that's frequently used for specialized studies of the pancreas, the liver, and the kidneys, as well as the many abdominal CTA protocols. We'll be talking about all these a little later. The factors that should be considered in determining appropriate injection protocols for these studies are the same as for the other areas of the body, which are contrast medium injection duration, the contrast arrival time, and the scan duration. So, just to reiterate, indications for CT abdomen pelvis to enhance or increase the CT density of the abdominal organ parenchyma. IV contrast increases the detectability of lesions, opacifies vascular structures, provides the assessment of organ perfusion and function. That's how the IV contrast is going. The organ is perfusing or emptying the blood, how the blood is moving through the organ. Non-contrast studies evaluate calcifications. They can be used for enhancements of unenhanced parenchymal attenuation values. They can identify calculi in the bile ducts, gallbladder, urinary tract, and the appendix. And I would just direct you to read Table 21.1 in Romans for a more extensive list of indications for CT. So before we go any further, we're going to stop here today. We'll pick up with the hepatobiliary system next, and we'll just go through the line, and these won't take as long, but we'll be focusing on the specific organs. We'll talk to you next time.